One of the best things we can do for our health is get a really good night's sleep, something that's true for kids as well as adults.
But not every child is able to sleep like a baby, so there is help available at the Helen DeVos Children's Hospital.
We have Dr. John Schuen here, Chief of the Pediatric Pulmonary and Sleep Medicine Division at Helen DeVos Children's Hospital. And I think this is something that a lot of parents and grandparents can relate to, caregivers too, because you worry so much. Sleep is so important for kids and babies.
It really is. If sleep doesn't happen well and for enough hours every night, then children get crabby, irritable, they don't perform as well in school. Things just don't go as well in life.
Yeah.
Well, you know, this is one of those things that a lot of people don't spend a ton of attention on. There's only 50 of these specialized treatments in the United States, and the Helen DeVos Children's Hospital has one of them.
Yes, West Michigan is blessed with a pediatric-only sleep disorder center, and so we're accredited by the American Academy of Sleep Medicine and to take care of children specifically with sleep disorders. You know, the most common in children is the persistent snoring child, but we deal with all sorts of different and varied sleep disorder problems. In fact, we just added a behavioral sleep medicine person for pediatrics.
Okay, as a parent, I'm really curious, how do you know if your child is having trouble? What kind of symptoms would you see or should you be watching out for?
Well, the child who persistently snores is someone who really snores whether they're sick or well, whether they have allergies or no allergies. So if you have someone who's snoring maybe for 3 months out of the summer, it's possible that they have a ragweed allergy or allergy to grasses or outdoor environment. So it's the persistently snoring child, and they may experience mouth breathing, they may notice the child gasp or struggle to breathe in the middle of the night. They may or may not have daytime symptoms, but if they do, it's often related to school or behavior. They tend not to be tired, which is different from the adult world. If you or I have obstructive sleep apnea as adults, we're going to be tired and sluggish throughout the day. Children tend to be impulsive, particularly the grade schoolers, difficulty focusing on the tasks in school, may not be able to stay in their seat or listen to the teacher or complete their lesson. So a lot of academic problems. And so the good news is there's ways to diagnose and treat those.
Well, you know, a lot of children are restless when they go to bed, and you're trying to think, okay, is this a bigger problem? Are there things that parents can do before bedtime that they can kind of check this to see if this is a bigger problem, or maybe it's just the sugar that they're getting before bed?
Well, I think the child who is persistently restless and stands out in their family may be someone who is of concern, and usually linked with snoring. And it doesn't have to be loud snoring that shakes the doors and rattles the windows. It can just be a low, persistent rumble. And the key thing is that it happens regularly. So if the parent stands outside the child's bed for a few minutes each night, for a week or two if they're not sure, then they'll probably get a sense of whether or not their child is persistently snoring or not.
What about some of the treatments? As a mom, I know that sometimes kids are willingly doing things to kind of get better, but sometimes it can be a little bit difficult, a little bit different from adults, because, you know, we get frustrated, we want to sleep, we might, you know, opt for a sleeping mask or different types of treatments. I'm curious what you do with kids, because, you know, the cooperation level involved.
Yeah, is a bit of an issue, right?
Yeah.
Well, the good news is, if a child has obstructive sleep apnea, the first recommended course of treatment is really an adenotonsillectomy, and so that's a surgical removal of the tonsils and the adenoids. The good news is, in our generation, we have much better tools to discern just someone who's snoring a little bit, but maybe otherwise normal, and the child who has obstructive sleep apnea. And so we know that 10% of children snore. Only 2 to 3% of that population have obstructive sleep apnea. So that's where the Sleep Disorders Center comes in handy. So we actually evaluate those children, determine whether or not they need an overnight sleep study, and then we book them for a night. And that's the gold standard of diagnosis for that condition.
Well, you know, we are so lucky in this community to have the Helen DeVos Children's Hospital right here in our backyard. If someone is watching this at home, a parent, and they think, that is definitely my child, how can they bring them in? Who should they call?
You know, they should really start with their primary care physician. I think that's the best and first place to go, because they may identify things that really they may not need a sleep disorder center for. If the child has allergies that may have been previously undiagnosed, they can tackle that and could put an end to the snoring before they even need to see us. But our office number is 616-267-2200, but they should really start with their primary care doctor.
Yeah, Dr. Schuen, thank you so much for coming in and sharing this information. I think it's a good revelation that people know that we actually have this kind of center right here in West Michigan.
Thank you very much. I couldn't agree more. We're very fortunate in this center, in this West Michigan.
Yeah.
Thank you.
We'll be right back. Don't go away.